Good morning, dear student. I am Dr. Rekha Jivne, Professor and Head, Department of Physiology. In my previous lecture, I discussed with you what is blood pressure, what are the different components of blood pressures, physical, physiological and pathological variation of blood pressure. Hope all of you understood my lecture. Today I am going to discuss with you regulation of the blood pressure. At the end of my lecture, you must able to answer the following. Mechanism involved in the regulation of blood pressure, rapid or short-term regulation of blood pressure, intermediate regulation of blood pressure. We know that arterial blood pressure is controlled by several mechanisms, which under physiological condition maintain the normal mean arterial pressure within a normal range of the 95 to 100 mmHg. There are the various mechanisms controlling the arterial blood pressure. These are the nervous mechanism, renal mechanism, hormonal mechanism, local mechanism. Nervous regulation, the regulatory center present in the medulla oblongata of our brain. So, in the medulla oblongata, there are the vasomotor center and the cardiac vagal centers are present. These cardiac vagal centers and vasomotor center, these both help in the regulation of the blood pressure. Second one is the renal mechanism. Renal mechanism, they act by regulating the extracellular fluid volume and the renin-angiotensin mechanism. This is also known as the long-term regulation of the blood pressure. Hormonal mechanism, there are the different hormones which help in the regulation of the blood pressure. Local mechanisms are also there. They causes the maintain the blood pressure by vasoconstriction and the vasodilatation. Now first we discuss the nervous regulation. Regulation of arterial blood pressure occurs by the three mechanisms. That is the rapid or short-term regulation of blood pressure, intermediate regulation of blood pressure, long-term mechanism. Now in the nervous regulation, first one is the rapidly acting arterial blood pressure regulatory mechanism or short-term regulatory mechanism. Why it is called the short-term regulatory mechanism? Because it acts within second to minute after the blood pressure become the abnormal, and it operate for a short period and then it adapt to the new pressure. When we see some examples during sudden change in the body posture, when there is occur the sudden change in the body posture, there occur the change in our blood pressure which come toward the normal after the some time. When there is the profuse bleeding persons are there also occur the change in the blood pressure. The blood pressure suddenly falls and then it is the maintained by the different regulatory systems which are present in our body. Now under the neural mechanism, there are the baroreceptor reflexes, chemoreceptor reflexes and the cerebral ischemic reflexes. Baroreceptor reflexes. Baroreceptor reflexes, it operates between 60 to 200 mmHg range of the mean blood pressure, beyond which no discharge from baroreceptors occur. It correct about 2/3 fall of the mean blood pressure. Fall in the mean blood pressure decreases inhibitory discharge from the baroreceptors to cause the less inhibition of vasomotor center and the less stimulation of the cardiac vagal center. It results in increased sympathetic and decreased parasympathetic discharge to restore blood pressure toward the normal. Baroreceptor reflex mechanisms So we know that baroreceptors are also known as the mechanoreceptors, pressure receptors, these are the stretch receptors located in the wall of the heart and the large blood vessels. These baroreceptors are the carotid baroreceptor, aortic arch baroreceptors, and other systemic arterial baroreceptors. Carotid baroreceptors, as we know that these carotid baroreceptors are the present in the carotid sinus, which is a small dilatation of the internal carotid artery, just above the bifurcation of common carotid artery into external and the internal carotid branches. Aortic arch baroreceptors, it is located into the arch of aorta. Other systemic arterial baroreceptors found at the root of the right subclavian artery and the junction of the thyroid artery and in the common carotid artery. Now the neural signals arises from these baroreceptors and it goes to the cardiovagal centers which are located near the medulla oblongata. According to that, if there is the increase in blood pressure, so increase in blood pressure is there, so higher discharge of the impulses from baroreceptors is goes and it causes the blood pressure to increase or the decreased. Innervation of baroreceptor, carotid sinus baroreceptor. Carotid sinus nerve, also known as the hearing nerve, branches of the glossopharyngeal nerves. And all other baroreceptors, these are supplied by the vagal nerves. Now the buffer nerves, the carotid sinus nerves and the vagal fibers from the carotid sinus and aortic arch baroreceptors are known as the buffer nerves. And these buffer nerves are involved in buffering the blood pressure, preventing sudden rise and fall in blood pressure. Now when we talk about the projection from the nucleus tractus solitarius and how these baroreceptors are activated. When there is an increased discharge, increased blood pressure is there, then the afferent fibers from the baroreceptors, from the carotid sinus and from the aortic arch, carotid sinus nerves and aortic arch via the vagus nerves, it goes to the medulla oblongata. In the medulla oblongata, they secrete the excitatory transmitter that is known as the glutamate. Now, these excitatory impulses goes to the depressor area of the vasomotor center. In the depressor area of the vasomotor center, it stimulate the GABA, gamma aminobutyric acid. When this is GABA, it is the inhibitory in the nature. When the inhibitory neurotransmitter is there, so it inhibit the excitatory impulses which is coming from the nucleus tractus solitarius. This inhibitory impulses goes to the pressor area of the vasomotor center. In the pressor area, it inhibits the pressor area of the vasomotor center. Then this efferent impulses from the vasomotor center, it goes to the spinal cord. In the spinal cord, it goes to the sympathetic nervous system. In the sympathetic nervous system, it decreases the activity of the sympathetic nervous fibers. When the activity of sympathetic fibers are the decreases, we know that sympathetic fibers, it supplies or it innervate all the musculatures of the heart. So it decreases the activity of the heart as well. Apart from the heart, it also supplies the blood vessels. So it decreases the activities of the heart as well as the blood pressure, the blood vessels. So when we see the baroreceptor reflexes, Mary's reflexes, when there is an increase in the blood, Mary's reflexes is nothing but when there is an increase in blood pressure, there is a decrease in the heart rate. When there is an increase in blood pressure, stimulation of baroreceptors. When the stimulation of baroreceptors, it goes to the tractus solitarius. It causes the stimulation of the tractus solitarius. When the tractus solitarius are stimulated, tractus solitarius, it secretes the excitatory transmitter, and then these excitatory impulses, it goes to the vasomotor center. In the vasomotor center, first it goes to the depressor area. From the depressor area, it goes to the pressor area. So because of the GABA, that is the inhibitory neurotransmitter, it inhibits the pressor area of the vasomotor center. When it inhibits the pressor area vasomotor center, there occur the decreased activity of the sympathetic nervous system. When there is the decreased activity of sympathetic nervous system, there occur the decreased sympathetic tone, and this decreased sympathetic tone, it goes to the blood vessels and the heart, and it causes the vasodilation and the venodilatation. When there is the stimulation of the cardiac inhibitory centers, है ना, this tractus solitarius is stimulated. This stimulation, it also goes to the impulses, also goes to the cardiac vagal centers, which is located, nucleus is located in the nucleus ambiguous. When we know that the cardiac inhibitory center, as the name suggests, it is the parasympathetic and it is the inhibitory in the nature. So heart rate is decreases and it lead to the bradycardia. So increase in the blood pressure, decrease in the heart rate is known as the Mary's reflexes. When we see the regulation of blood pressure by baroreceptor mechanism, when there is a decrease in the blood pressure, stimulation of the baroreceptor, from the baroreceptor, afferent impulses via the 9th and the 10th cranial nerves goes to the nucleus tractus solitarius. In the nucleus tractus solitarius, inhibition of the vasomotor center, stimulation of the cardiovagal centers occur. When inhibition of the vasomotor center occur, inhibition of sympathetic nerves occur, and decrease in the blood pressure. When the stimulation of the cardiac vagal center is there, stimulation of vagus nerve and decrease in the blood pressure. When we see the effect of the blood pressure, baroreceptor stimulation on the heart, arteries and the vein, when there is the stimulation of baroreceptor, inhibition of VMC, stimulation of CVC. When there is the inhibition of VMC, inhibition of sympathetic nerve. Then inhibition of sympathetic nerve, when how it act on the heart, on arteries or the vein. On the heart, it decreases the chronotropic effect, inotropic effect, bathmotropic effect. All the effects are decreases. On the artery, it causes the vasodilatation, decreased peripheral resistance, decreased blood pressure, decreased blood pressure. On veins, it causes the venodilatation, decreased venous return, decreased cardiac output, or decrease in blood pressure toward the normal level. Chemoreceptors. This is all about the baroreceptor. How does baroreceptor it act in the regulation of the blood pressure? Now we see the role of the chemoreceptor reflexes, how it help in the regulation of the blood pressure. These chemoreceptors sensitive to change in the blood chemistry. Main functions of chemoreceptor is to keep alveolar partial pressure of the carbon dioxide at the normal level of 40 mmHg, maintain arterial partial pressure of the oxygen and the partial pressure of carbon dioxide and the pH. Chemoreceptors, these are the carotid bodies and the aortic bodies. Carotid bodies located in the bifurcation of common carotid artery. These are innervated by the carotid sinus nerve, which is a branch of glossopharyngeal nerve. Aortic bodies, one of the three in number, located adjacent to the arch of aorta, innervated by the aortic nerve, which is the branch of the vagus nerve. Now the role of the chemoreceptor. They are the chemosensitive cell that respond to change in the blood. Oxygen. When there is a decrease in the partial pressure of the oxygen, so oxygen lack, carbon dioxide excess, increase partial pressure of carbon dioxide, hydrogen ion excess, or the decrease in the pH. When we come to the functions of the chemoreceptors, it functions, it acts on the respiratory centers as well as the cardiovascular control. Respiratory centers are primarily concerned with the regulation of pulmonary ventilation. When we talk about the cardiovascular control, in physiological condition, in healthy individual breathing normal air, there is a very little discharge from chemoreceptor and there is no contribution to the regulation of the cardiovascular system. The chemoreceptors exert their roles only in the following condition: in hypoxia, in hypotension. In hypoxia, there occur the increased chemoreceptor discharge, which not only produce hyperventilation but also excite the vasomotor center, leading to peripheral vasoconstriction and increase the blood pressure. Thus, unlike the inhibitory action of arterial baroreceptors, the chemoreceptors have excitatory effect on the vasomotor centers. When there occur the hypotension due to severe hemorrhages, the increased chemoreceptor discharge may help to raise the arterial blood pressure. The role of chemoreceptor can be described in the various animals where there occur the fall in the blood pressure, and in this type of the animals the baroreceptor discharge is already absent. The section of sinus and aortic nerve abolish the chemoreceptor drives. When fall in the blood pressure in such animal indicate that chemoreceptor were contributing to some extent to the maintenance of the blood pressure. When there is increase in the heart rate, increase in the blood pressure. When there is an increase in blood pressure, stimulation of baroreceptors and increase in the perfusion pressure. When there is the stimulation of baroreceptor, chemoreceptors are also stimulated. Or chemoreceptor reflexes. The chemoreceptor reflexes operate between the 40 to 100 mmHg range of the mean blood pressure, correct approximately 2/3 of the further fall of the mean blood pressure. Fall in the mean blood pressure below the 80 mmHg, there occur the blood flow to the tissue. Fall in the blood flow to the tissue. So, there occur the decrease in the partial pressure of oxygen, increase in the partial pressure of the carbon dioxide of carotid and the aortic bodies. And this causes the decreased concentration of the oxygen and increased concentration of the partial pressure of the carbon dioxide. It causes the stimulation of the vasomotor center, cardiac vagal centers and the respiratory centers. And this increases the heart rate, blood pressure, rate and the depth of the respiration. When there is fall in the blood pressure below the 60 mmHg, there occur the hypoxia. When there is the hypoxia, chemoreceptors are stimulated. When the chemoreceptors are stimulated, it had the effect on the nucleus tractus solitarius, respiratory centers, cardiac inhibitory centers. When there is the chemoreceptors are activated, the vasomotor centers are the stimulated. And when the vasomotor centers are stimulated, it causes the increased action of the sympathetic nervous system. And when the chemoreceptors are the stimulated, cardiac inhibitory centers are also stimulated. And these cardiac inhibitory centers, the nucleus of these cardiac inhibitory centers are located in the nucleus ambiguous. This decreases the vagal tone. When the vagal tone decreases, there increase in the heart rate, blood pressure, and increased pulmonary ventilation occurs. Now the chemoreceptor reflex is not a powerful arterial pressure controller in the normal arterial pressure range, because the chemoreceptor themselves are not stimulated strongly until the arterial pressure fall below the 60 mm Hg. Therefore, it is at lower pressure that this reflex become important and help to prevent still further fall in the pressure. Now the other response is the other mechanism for controlling the or regulation of blood pressure is the CNS ischemic response. It operates between the 15 to 50 mm Hg range of the mean blood pressure, and it corrects approximately 11 by 12th of the further fall of the mean blood pressure. If the blood pressure falls below 40 mm Hg, the last ray of the hope for survival is the central nervous system ischemic response. It is sometimes also known as the last ditch stand pressure to control mechanism. When there is fall in blood pressure below the 50 mm Hg, CNS ischemia occur. The blood flow to vasomotor area in the brain stem is decreased enough to causes the CNS ischemia. As a result of the CNS ischemia, the carbon dioxide, lactic acid are accumulated locally near the vasomotor center and excite the neurons of the vasomotor center. Powerful sympathetic discharge throughout the body. And this led to the increased heart rate and the blood pressure and normal blood supply to the brain. Excitation of VMC causes strong sympathetic stimulation leading to the vasoconstriction. Peripheral vessels become totally occluded at certain area. Examples are the kidney. CNS ischemic response act as the emergency arterial pressure control system. If rise of pressure does not relieve CNS ischemia, neural cells begin to suffer and within 3 to 10 minutes become totally inactive. Now these are all the short-term regulation of the blood pressure. Now we come to the intermediate regulation of the blood pressure. Intermediate blood pressure control mechanism. These mechanisms become active after several minutes of acute pressure changes and reaches full function within a few hours. Remain active from a few days to few weeks. And that short-term regulation, it remains active for the few minutes to the few seconds. This mechanism control the alteration in blood pressure by altering the blood volume. Intermediate blood pressure control mechanisms. These are stress relaxation, reverse stress relaxation mechanism, capillary fluid shift mechanism. First we discuss about the capillary fluid shift mechanism. Capillary pressure is directly proportional to the arterial blood pressure. Increased arterial blood pressure increases the hydrostatic pressure at the arterial end. Fluid shifted from the capillaries to interstitial fluid compartment. So, arterial blood pressure decreases or become normal. This capillary fluid shift mechanism restores both high and low blood pressure to normal. When there is the raised blood pressure, mean capillary pressure is high. When the mean capillary pressure is high, the fluid shifts from the capillary wall into the interstitial fluid compartment. So when it shifted to the interstitial fluid compartment, there occur the reduced blood volume to restore. There occur the reduced blood volume, and this causes the decreased arterial blood pressure. Reverse changes take place when the blood pressures fall. Now the other intermediate regulatory mechanism for control of the regulation of blood pressure is the stress relaxation phenomena. When there is an increase in blood pressure, blood vessels are stretched. When blood pressures are stretched, stress relaxation occur, and this increases the capacity, decrease effective blood volume, blood pressure decreases, and the blood pressure come to the normal level. Stress relaxation, when there is the intravenous infusion of the fluid, there occur the increase in the arterial blood pressure. When there occur the increase in arterial blood pressure, blood vessels are stretched. When the vessels are stretched, increased perfusion pressure in blood storage organs occurs. Blood storage organs mean the veins, arteries. There occur the increased perfusion pressure. When there is the increased perfusion pressure in the veins and the arteries, there occur the relaxation of the blood vessels. When there is the relaxation of blood vessel, the venous return, cardiac output become decrease and the blood pressure become normal. So this is known as the stress relaxation. Whenever there is the stretching, there occur the increase in the perfusion pressure. When the perfusion pressure increases, the volume of the blood vessel it decreases. It decreases, so the relaxation of the blood vessels occur, and there occur the decrease in the venous return, cardiac output, and the blood pressure come toward the normal. When we talk about the reverse stress relaxation, whenever there is the decrease in the arterial blood pressure, less stress on the blood vessel, perfusion pressure in the blood vessels organ come to the normal, venous return, cardiac output increases, and blood pressure become the normal. When we compare between the stress relaxation, in stress relaxation, increased blood pressure in the blood storage organs, so there occur the vasodilatation. When the vasodilation occur, there occur the decrease in blood pressure. In the reverse stress relaxation, whenever there is a decrease in blood pressure in the blood storage organs like the arteries, veins, there occur the vasoconstriction, and this vasoconstriction led to the increase in the blood pressure. So these are the regulation of the blood pressure by the short-term regulation or the intermediate regulation. In next lecture, we will discuss the long-term regulation of the blood pressure. So this is all for today's lecture. Thank you for listening me.